Hi friends. Now many of you would have gone to the dentist with your children. Now after the extraction is done, okay, we need to follow some things so that no complications or difficulty occurs post extraction. Now the first thing that I would like to tell you is that whenever a child's tooth is removed, okay, there are two things that we have to take into mind. One is the effects of the local anesthetic and the effect of the extraction itself. So about the local anesthetic, try to understand that the if it is for a lower tooth, then the cheek, the lips and the tongue will be numb, and in the upper also the cheek and lips will be numb. Okay, so and that effect lasts for at least 2 hours. So see to it that the child doesn't eat, drink, or talk, or does minimal talking at least for the first 2 hours. So no problems related to the local anesthetic occurs, because if he talks, if he eats, or if he chews, what happens? There is a probability that he might bite his cheeks, lip, or tongue, and he might injure that area, and there is possibility of development of little swelling and discomfort in that area. It is nothing very alarming, but that can be very easily avoided. And once the anesthetic effect is over, they can begin their routine. Now begin their routine means what? Now first thing is that after extraction there's going to be a lot of bleeding which is happening. So the first thing that is to be done is the control of bleeding. So most of the dentists will put a nice cotton with a gauze pack, and they will ask the child to bite onto it at least for half an hour to 1 hour. Because of this pressure, what happens that the bleeding gets controlled. Now if the child can hold the cotton for half an hour or 1 hour, it's great. But if the child is too small, okay, so then the parent will have to hold the gauze in the place and maintain the pressure in that area, because the first 30 minutes is very crucial, and generally the clot forms and the bleeding gets controlled. Now this is one thing. Now sometimes what happens, since there is a lot of saliva in the mouth, the gauze becomes like quite wet and soaking. So you can change. So what we do in our clinic is we give the parent 4-5 extra gauzes also, so okay, they can change once it is too much, it is too wet. Okay, and after that what you can do is that you can throw the gauze safely away in your dustbin or some safe place. See that it is not thrown on the road. Now the next step, what about the medications? Now the dentist see to it that no medication is taken immediately post extraction. The medicines have to be taken only after the anesthetic effect is over, that is after 2.5 hours. Okay, generally the pain is not so much, and it is well maintained and well controlled with the help of simple medications which the doctor gives. But if the pain persists for more than 48 hours, please visit your dentist immediately. Now the third aspect is the diet. Three things are very important. You're not supposed to eat anything hot, hard, and spicy. Okay, that has to be avoided. That means the child has to be on a very soft diet. Now what happens, what do you mean by bland? And we generally prefer a bland diet. Bland means what? Don't add too many spices to it, because the spices will reach in the areas of the extraction and it might create a burning sensation. Okay, and hard means, I'll give you a simple example, that suppose if you're eating a carrot is a nice vegetable and it's quite hard, but if the tooth has been extracted, then you have to give a boiled carrot. So boiled vegetables are quite good, then nothing crunchy. Okay, see for example snacks like kurkure, wafers, chewda, okay, peanuts, cashew nuts, walnuts, all this have to be completely avoided because they're quite hard. Then carbonated drinks, no cold drinks at all, no hot coffee, no hot chocolate or hot tea at all, at least for the first 2 days. And one thing that about the food, avoid if you're a non-vegetarian, avoid chicken with bones. Fish has to be completely be avoided, and pizza and all these things, extreme hot stuff and extreme hard stuff, has to be avoided considerably. Now what are the next question is, then what are we supposed to eat? Okay, generally a very soft diet, say something like upma, shira, rava is very good. You can have even eggs, boiled eggs, and the various counterparts of eggs like scrambled eggs or bhurji, all that which is very soft, can be eaten very easily. Mashed potatoes, for example. Then you can have caramel custard, pudding, jelly, all that stuff is quite good. You can the hot soups have to be avoided. It's preferable to have nice room temperature based vegetable soups, broths, fruit juices, milkshakes are a complete yes. I mean, I will generally prefer a liquid diet at least in the first day. So no eat. So most of the eating part is avoided. The other part is that you have to avoid spitting. Spitting and drinking anything with the straw has to be avoided for at least 2 days, because when you tend to spit or you are sucking with the straw, there is extra pressure created and that causes a lot of bleeding. Now the other aspect is the parents ask, should we brush the teeth? See, on that day of extraction, suppose it's been done in the evening, avoid brushing. Yeah, take a small cotton, moisten it with water and just wipe the teeth. That is good enough, and you can use a little bit of a mouthwash also. Okay, mouthwash not in the form of rinsing and gargling. You can just moisten the cotton with the mouthwash and just wipe the teeth. That's very good. Now the other aspect is the activities. The child should not go for any outdoor sports like football, hockey, cricket at least for a day or two, because if it gets hurt, and see, in these games you tend to shout, talk, and excessive movements in the oral cavity region have to be avoided. So they can watch TV, maybe play simple games in the house like chess, and nap is the best thing. Now swelling aspect. Now many a times a mild swelling can occur. Now the best way to avoid this kind of thing is ice pack application. Ice packs are generally there in all the houses. So you just place the ice pack over externally. Okay, you place it for a minute or two, then wait for 5-10 minutes and reapply. You can do this process for at least 8 to 10 times. So this will take care of the swelling, and cold always helps in control of bleeding too. Now suppose if you don't have an ice pack, if you have a fridge, there will be ice cubes. You put it in a handkerchief or something, hold it and place it over the affected area externally. Nothing warm, like hot fermentation, taking that hot steam or that any hot application has to be avoided, because that will increase the swelling. Okay, so anything hot has to be completely avoided for the first 22 hours. Yeah, from the next day, if the child is old enough, he can do a little bit of salt water gargles for two or three times a day. This helps in the healing considerably, but not in the first 24 hours. Now many people, whenever we have any injury or pain or muscle this, we tend to put balms or any external ointments have to be avoided completely, because they will flare up the situation. Okay, and then see to it that you warn the child that he should not put any objects, any pencil, fingers in that extracted area. Children are very fidgety. They tend to touch that area. They'll keep on retracting, checking. Please, keep a complete watch over them. And if you have toddlers and anything, see that hard toys are not in their vicinity. Now, what about the ice cream? Ice cream is the best solution, and it is kind of a best bribe which you can always give a child. That, see, if you sit properly for the extraction, I'll give you an ice cream. Yeah, so ice cream can be given. It is very good, but it has to be given after 2 hours, and you have to give a softy type of an ice cream in a cup, and it is supposed to be eaten with a spoon. Plain ice cream, any flavor will do. Avoid flavors like butterscotch, choco chips, nuts and raisin. Anything which has something hard in it has to be avoided, because these particles will stay inside. Those waffles and cones have to be completely avoided. Now what is the alternative to ice cream? Suppose in these times, if a child is having a lot of cough and cold and all those things, so he can have curds, yogurts, cold milk is also a very, very good alternative. Now one more thing about the sleeping thing. How is the child supposed to sleep? So when the child is sleeping, see that you put an extra pillow so that the head is a little bit elevated, and see that he doesn't sleep on the side where the extraction is done, because if he sleeps on the side where the extraction is done, a lot of bleeding can occur because of pressure. And warn the parent. Okay, in the morning, next to the pillow or in that region, you might have a small, like a nice red or pinkish patch, because saliva and little bit of blood might ooze out. So there is nothing much to worry. And see, all these instructions are very, very important, and you need to follow them. And a recall visit is always advisable after 4-5 days post extraction. And if you feel that there is any issue, any worry, or any complication, or something which you can't understand, give us a call. We will be more than happy to help you out. I'm Dr. Yusuf Chunawala. I'm a pediatric dentist and bad breath specialist. I'm practicing in Pune. Thank you so much for your valuable time. Thank you.